Hey everybody, I'm your host Eric Mueller, and welcome back to the Eric Mueller Show, the podcast where we explore what makes any successful person's inner clock tick. Are you a healthcare professional? If not, are you still impacted by the delivery of healthcare services? Absolutely. My guest today, Ed Eichhorn, is the president of Medilink Consulting Group, and he's the author of a book called Healing American Healthcare. Now, Ed has worked in healthcare product and service development for many years. He's fundraised for multiple institutions of higher education, and he helped found a successful medical testing company. That company operated for 10 profitable years before being acquired. As a consultant, Ed advised multiple medical societies during the development of Obamacare. He's written editorials on universal healthcare for U.S. News and World Report, smrcomish.com, and many other online publications. In 2020, Ed started the Healing American Healthcare Coalition, where he publishes a twice-monthly newsletter for members called the 3-Minute Read. This newsletter is designed to keep healthcare professionals, potentially like yourself, informed on important research and industry news. Ed strongly believes that healthcare is a right, not a privilege, and that seeking healthcare should not have the potential to lead to bankruptcy. Together with his co-author, Dr. Michael Hutchinson, Ed has created a universal healthcare plan for the United States that would actually save our country, now wait for it, $1 trillion per year. I hope that those of you working in healthcare especially enjoy this one. Let's head on over to the interview. All right, so welcome back to the Eric Mueller Show, the podcast where we explore what makes any successful person's inner clock tick. Now, where are my healthcare enthusiasts at today? You may work in healthcare, but even if you don't, you're affected by healthcare. It's a big part of everyone's lives. You got to be healthy, you got to stay well. Well, my guest today is a successful healthcare executive and entrepreneur who has created a plan to provide quality healthcare for all Americans, while at the same time saving the country $1 trillion a year. Welcome to the show, Ed Eichhorn.
Thanks, sir. Great to be with you today.
Yeah, I really appreciate you being on. It's an absolute pleasure. And Ed, so starting off here, you have experience as both a healthcare executive and you're an entrepreneur. So on this podcast, I've interviewed some CEOs, some founders, people that have, more of that executive experience, but then also those that have started their own thing. And you kind of blend both those together, which I think is really cool. Would you share how you generate new ideas if we have someone listening that has aspirations to do something entrepreneurially?
Well, sure. In my experience, it has to do with passion. What are you passionate about? And what are you observing? What problems do you see that you can address and perhaps solve or make better for part of the population or the people that you know or for yourself? And when you experience the problem solving that goes along with your passion for an idea, that's where success comes from. Because when you're passionate about something, you are willing to spend the time and the effort to try to make that a reality. And, you also learn a great deal if you're passionate about something and you fail a little bit, because that helps you to learn what the boundaries are for you to be successful the next time you have a great idea related to things that you really care about.
Now, did you always know that you wanted to do entrepreneurial things? Or I know, at least in my experience, Ed, it wasn't really something that was always there. It started to come on a little bit slowly later on, but then I fully realized that this is definitely a route that I want to pursue and explore more. So I guess, was that a passion for you at a really young age, or did you find that come a little bit later on in your career?
Well, that's a good question. When I graduated from engineering school, I wasn't sure what I wanted to do. And I took an interview with a large medical company, and it sounded really interesting. So I took a job as a product development engineer at a large company that Becton Dickinson is its name. And it's been around for many, many years, very successful medical device company. And after I'd been there for about 6 years, I was selected to work with a consultant to actually do a hospital-based product search. And what that meant was, myself and this other person, we were based in hospitals for almost a year. And we came back to BD and we reported that we found 50 ideas for new products for the company. And the idea of finding new ideas in the hospital setting was exciting. And, I thought, gee, this is something I may want to do in the future. I left BD to be the director of research at a kidney dialysis company a year or two after that. And as I got into that process, my colleagues at that company and I decided it was time to start our own business to provide better services for dialysis patients. And that began my real applied interest in entrepreneurial activity. We started a company with just 4 of us. Within a few years, we had 120 employees, and we were providing physiological testing in 38 states. Eventually, we sold that company to a large nephrology company. But doing that hospital product search and looking at the needs for new products that people had really stimulated me to think about what can I do to be a help to this industry, and how do I do this if I need to do it entrepreneurially? And that's what led to our business that was based on providing physical testing services for dialysis patients around the country.
Yeah, well, and also, like, I mean, you kind of shared a little bit of the way that you discovered that there was a problem that needed to be solved. You could see in your own space where improvements need to be made. Is there anything that your mind goes to right now? So we're coming towards hopefully the end of a pandemic in 2022 right now, in early 22. Is there anything that you think, might be the next big thing on the horizon, whether that's in healthcare or just, in America as a whole? Is there any type of entrepreneurial type seed that you might be able to plant for someone listening if they have, maybe they have expertise in an industry that is totally unrelated to healthcare, but, it still relates to the American public?
Well, I think it's a good idea to look at the industry you're in or the business practice you're in, and to look at how the pandemic has affected your business over the last couple of years, and what solutions can you offer or new ideas can you offer to prevent your business from being adversely affected by a future pandemic. Because our healthcare, public health people tell us all the time that there will be more pandemics. And there have been pandemics in the past that we escaped. I mean, we didn't have the Ebola pandemic here. The swine flu really didn't work out to be as horrible as it could have been, like this pandemic has been. For example, one of the problems of the pandemic as it began was the supplies that were needed to protect us, like masks and gowns in the hospital industry and gloves and things like that, were all made in China and other places on the Pacific Rim. So those products started to go to the highest bidder, or just weren't available because they were needed in their home countries. So strategically required products for healthcare in the time of a crisis should be made in the United States. And if you're in that supply chain and you have the drive to do that, or thoughts about how to make that work, that's an interesting area to be working on, because there's a lot of thought and interest about how do we protect our need for supplies in the event of another emergency. And I am sure there are a number of businesses that could use some additional help. For example, it is well known that ultraviolet light kills viruses, but it's not a good thing for you to see or be around. But if you could figure out how to put ultraviolet light in the air handling system in a restaurant, you can make it very easy for people to actually go back and enjoy dining out inside, as opposed to perhaps having to spread out or be outside. So, I mean, I'm sure if you think about the many industries and businesses that have been affected by the pandemic, there are a lot of potential ideas and solutions that could develop new businesses, new opportunities, and could actually, create a better economic environment for the future of our country.
That's perfect, Ed. I appreciate you sharing that, because I think it's challenging if you're just starting off on your entrepreneurial journey. And like myself, I've learned from all these cool individuals like yourself about how they think and what they've found to be successful in their journeys to think in those ways. But it's challenging. I mean, obviously you want to think of things that affect you personally, because you're in that, fight, so to speak. So if you're working in, healthcare, if you're a physician, on a day-to-day what affects you and what doesn't. So it's right in front of you. But it doesn't mean that it's easy to have that idea come to you. So you really, I mean, you got to put that work in, so to speak. And you didn't have that happen immediately. It was still a process for you.
That's correct. I was very happy to be developing products that the market required when I first started my career, and I was learning how how do you make these things? How do you make a medical device, and how hard is it to do that? Things of that nature. And that was a good, every day that we go to work, we can learn something if we want to pay attention to what we're doing. And sometimes the learning is at such a slow rate, you all of a sudden realize after a year or two of all the things you've actually learned that you can use as an entrepreneur or as a professional or whatever it is you want to do in your business life. And I still have lessons all the time that help me to choose the next thing we're going to do and how we're going to do it. And I'm fortunate that I have a small team of colleagues in my consulting practice and in my work with the Healing American Healthcare Coalition that allow us to be efficient with our time and to produce our newsletter or project deadlines in other projects that I have going on, so that we can do things in a reasonable way and don't have to work 14 hours a day to do them. You have to figure out how to provide the things you need for your family or yourself while you're also expanding your career. And it takes some time to learn how to make that balance.
Yeah, I think that's a great point, because that's kind of where my mind goes to with, and I'm sure a lot of you listening feel the same way, that if you have some of these desires outside of your 9 to 5, your day job right now, you might think, how do I make the time? Maybe you have a family, or you're getting married, or you're starting, you're going back to school to get a further degree, a master's or something after your professional degree if you're in healthcare. And you might be thinking, how do I balance this? How do I balance all of this and at the same time, write a book or start a side hustle or do something, related to learning a new skill that can help me as an entrepreneur? So, Ed, is there any tips that you can share as being a seasoned, experienced individual in this space? Is there any time management tips that you found helpful?
Yes. And one that people don't often think about, Eric, that I would like to start with is there have been studies done over the years. And one of the studies that I read some years ago that I've always thought about is, do you accomplish more if you're a workaholic than if you work 9 to 5? Or, if I work normally 10 hours a day or 11 hours a day, do I accomplish more if I work 15 hours a day? And the answer is no. The answer is, when you work too many hours, you get fatigued and you do things slower, or you take a little bit more time to relax in between. And you say, oh my God, I've been here 15 hours and I've accomplished whatever I've accomplished. In my career, I have met 2 individuals who actually work, very long hours, and it's their choice, and they're extremely productive all the time.
Wow.
So it's important to realize that for most people, you just can't work every day, 14, 15 hours a day, and actually accomplish more than if you use your time more effectively. If you are working 9 to 5 someplace and you're in a professional environment, you have to work a little more once in a while, and you have that side hustle that you're very interested in, you just have to set aside some time now and then for that side hustle. When I did the research for my first book in the Healing American Healthcare series, I actually had some time in my consulting practice that I could dedicate. So I was doing research for the book 3 or 4 hours on average a day. And then when I started writing, I only wrote an hour and a half to 2 hours a day, because there was a fatigue factor. As my wife says, I can write a great business letter, but she wouldn't want to read a novel that I wrote, because I'm a very technical guy. So the writing part took me a lot of time. And my co-author and I would write sections, and then he would edit the other person's section to try to make them more readable and more more enjoyable for someone who wanted to learn about healthcare as we did. So I think the important thing is to think about the idea that you might have that solves a problem that you're passionate about, but then figure out how to budget the time you need for your family, for your day job, if you have a day job, and for your idea, because working more doesn't make you more productive in every case.
That's a great point. And I think it's probably tough to hear you might think working longer is just going to make you more productive. So if you wrote 4 hours a day for your book, you're going to have that output X amount more times than if you wrote the hour or the hour and a half. But yeah, it's pleasant to hear that that's not the case for you, because it I think it makes that balance piece stay so forefront in my mind, and hopefully the minds of those of you listening now, because, Ed, when you started that mobile testing business that eventually was sold, you were currently in a director role. So it's like it wasn't that you had nothing on your plate. I mean, you were managing a lot, and you also, took the time to methodically and slowly build something on the side that later became a monetary, sale for you.
Yeah, what my partners and I did, one of my partners went full-time starting the venture. And two of us started doing things with him in weekends and on the evenings when time permitted. And then when it was time for me to jump into that business, I certainly jumped in. And I was working 8 or 10 hours a day. And if I had to, it was a mobile medical testing business. And when I was doing the testing myself, I would do the testing, and then I would spend a lot of time driving from point A to point B. So my days were longer than 8 hours, but the actual work I was doing was in an 8 to 10 hour period, and driving equipment around and those kinds of things that were part of the entrepreneurial effort had to be done, and it took a lot of time, but it wasn't a lot of thinking time. I wasn't developing the idea. I was working on mechanics of making the idea happen. So the days were longer in the beginning, but as we built the company, it became a more normal job when we staffed the company in a way that allowed us to provide services all over the country.
Right. And I want to get to, so you mentioned earlier the Healing American Healthcare Coalition, which you started, but it's also, I think we should mention the books that you've authored on that topic. So Healing American Healthcare, the topic that I mentioned earlier was to save the country $1 trillion a year, was the plan.
Right.
that first book was based on that.
Right.
And you have a second book that is soon to come out about how the pandemic, where do we go in healthcare from here with the pandemic? So if you could just share, and knowing that I'll tag these in the show notes for the audience to access those books and where to purchase those, but just kind of share with us the framework, maybe from that first book, how you created that plan of healthcare and what makes it so unique, and really, I mean, why hasn't the country started doing it yet, maybe?
Healthcare is a very large part of our economy. It's around 19% of the GDP of our economy. And there are lots of interests in healthcare. We have a very, very strong pharmaceutical industry. We have a very strong insurance industry. And, we are capitalists. I'm a capitalist. And they want to make the profit that they need to deliver for themselves or their shareholders. And my concern was that started me thinking about the book was generated by healthcare legislation in 2017. At that time, the Speaker of the House put forward the Healthcare Advantage bill, which really was going to reduce benefits for people on Medicaid, was going to reduce taxes for some wealthy Americans. It was going to raise the cost of healthcare for people between 60 and 65. And I thought that was just the wrong path. So that started me on the research for the book. And essentially, the plan is that, we looked at the healthcare in many other nations, and to try to give you a quick 2-minute elevator speech.
Try to shrink it down to.
Basically, we think we should copy some of the better parts of the German healthcare system. Every employer in Germany has to provide healthcare, and it's 15% of the employee's salary goes towards that. And the employee can choose between 115 insurance companies that are called sickness funds for their healthcare. In the United States, we believe we should have what we called an all-care plan that employers could choose. We determined it would cost 30% than the current average cost of insurance. And basically, it would create competition for the insurance industry to be more cost competitive for businesses. It would also reduce the costs for the government for things like pharmaceutical costs. It would reduce bureaucratic costs. In the United States, we spend $230 per person on healthcare bureaucracy. In Japan, they spend $50 a person. So we attacked those things in our economy with respect to waste and high cost of insurance and poor outcomes. The Commonwealth Fund every few years evaluates 11 high-income nations, of which the United States is, of course, one. And routinely, for the last number of years, the U.S. comes out last in accessibility of care and outcomes and equity of care. And we wanted to address those things. So that's what we addressed in that book. And it's available through our website, and it's available on Amazon. And for people who join our healthcare coalition, we give them a free e-copy of our book. We want the idea to get out there. We have sent it to every congressperson who heads a committee or is a ranking member on a committee that deals with healthcare. And so we have done what we could do to get that idea out into the public. And, as people join our coalition, which only costs $12 a year, for which you get 26 newsletters, you can get a free copy of that book if you're interested in learning more about it. Our second book will be out in a couple of weeks, and it's a compilation of all of the articles we've reviewed in our newsletter over the last couple of years. And we monitor 70 sources on healthcare, and we choose 5 or 6 articles every week that we comment on, and we summarize so people can get information quickly, and then they can link on a part of our article to go to the actual full article online if they want to learn a lot more about that topic. So, that's kind of what we're doing and why we're doing it.
Yeah, that's phenomenal. I'm glad that you mentioned the 3-minute read newsletter, which you were talking about there. So I think that was something that caught my attention because you designed that to be, digestible by a busy healthcare professional. So a physician, nurse,
Right.
Pharmacist, physician's assistant, what have you, whatever industry, whatever type of institution they work in.
Sure.
They might not feel like they have the amount of time to digest this type of primary literature that's essential to them being on the top of their practice. So I think that's a great resource, and I will tag that in the show notes as well, because I think that's a incredible resource for anybody that's in healthcare to have. So Healing American Healthcare Coalition, if you join that, $1 a month for 12 months, $12 a year, you get the book, which probably is $20 by itself, and then you also get this newsletter every 2 weeks that really can keep you, just keep you on the top of what's going on.
Yeah, when we designed that, we actually we tested the newsletter. You got to be able to read this in 3 minutes, and you can. And the idea is to give people, the healthcare world is changing from a healthcare policy perspective, and all of the issues related to the pandemic and discoveries about the pandemic. And we wanted to get that information out to, physicians, nurses, healthcare finance people that manage healthcare centers or whatever, so that they have a grip on what's actually going on every couple of weeks. And in our second book, which is Healing American Healthcare as the title, which is kind of our brand, and the subtitle is Lessons Learned from the Pandemic. And it goes through all the lessons learned for the first 18 months of the pandemic. And probably there'll be a book 3 that looks at the next 18 months as hopefully the pandemic is something we see in our rearview mirror at that time. So, that's where we are.
Yeah. I think that's, the kind of where my mind goes with all of this is just the slow moving nature of government and healthcare in any country, but specifically the U.S. So I think, if you're thinking and you're listening right now and you have just an insane idea that, like Ed does, to change something that is managed by the U.S. government, you can present that idea, and it may take effect, but it may take forever for them to implement that. I think it's just it's crazy to me to think that we really should be looking at like Germany or other countries that are doing healthcare better. It's like, why are we not? You present them in this idea, why are they not acting on it? Is there certain red tape that needs to be cut, or what is the barrier, Ed, to this plan being implemented to help save Americans money and provide better healthcare?
Well, again, it's the challenge of the interest in play here. The pharmaceutical industry has been studied by a number of people at Harvard and other places, and generally we pay 2.5 times what other nations in the Organization for Economic and Cooperative Development of the United Nations, the 37 democracies that are in that organization. And we pay 2.5 times more for medications than they do. And 60% of them come from companies based in the United States. And the reason for that is other nations have different methods by which they negotiate drug prices with drug companies. We don't negotiate drug prices in the United States. In fact, in Medicare, when the part, I think it's Part D of Medicare is the pharmaceutical part, when that was negotiated, early in this century, it was agreed that they would pay a list price for drugs under Part D. Now, Medicare Advantage plans, which is Part C that Medicare beneficiaries can sign up for, they do negotiate. But if Medicare would negotiate, they could save $80 billion a year on drugs alone. If we could improve the coding system for services and set price structures that insurance companies can live with, we can reduce the cost of billing. I mean, it's outrageous that we spend 5 times what Japan spends on medical billing. And it's wrong 30% of the time. So, the complexity is what we want to reduce there. We also want to make, let doctors be doctors. That's part of our book. Pre-authorization is something that physicians and patients deal with for MRI and CT type studies, expensive studies. The insurance company approves whether or not the doctor can order what you need. Well, that doesn't use modern technology, and sometimes those things are approved more than 90% of the time, and it takes time. So if the doctor says you need a CT right now, he could order that directly if you're a straight Medicare patient, but everyone else, they got to get a pre-authorization. We think the doctor should be available to practice medicine, order whatever he wants, and the insurance company should monitor his utilization rate and go back to the doctor. Dr. Eric, you're ordering 5 times more MRIs than other nephrologists. Why are you doing that? And find out what his ordering pattern is about, and then restrict him on the backside as opposed to restricting him in the practice. Doctors spend 3 to 4 hours a week just in talking to insurance companies. They shouldn't have to do that. So we're talking about things like that. Now, making doctors doctors is more important here in the pandemic because a number of doctors have left medicine. As we were going into the pandemic, 35% of the doctors were over 55 years old. So when you put a lot more pressure on them in the pandemic, maybe they decided to retire. So, we need to deal with the shortages in staffing of physicians and nurses and pharmacists and everyone else who's in healthcare who's trying to step away from it because of the complexity of actually getting paid for the services you provide. So, those are the kinds of things that are part of the health plan. And it would save the government about $380 billion a year. And the rest of the savings goes to companies. The net savings for insurance in the competitive insurance market with our plan would be about $175 billion a year across all industries. So, that kind of savings would create, economic opportunities to improve businesses, to start businesses, and to invest in business. So, we think there's a great demand for this, but there are those interests like, well-established insurance companies and a tremendous pharmaceutical industry that would rather not give up their pricing advantages. So I think there's a lot of pressure here and a lot of potential lobbying. One more statistic I'll give you: the pharmaceutical industry has 815 lobbyists. Okay, across their associations and across the companies. There's 100 senators and 435 congressmen, and there's 815 lobbyists that pull on them, and of course, state legislatures as well.
Yeah, so almost twice as much is how the math works out there. So I think so. So in other words, you have kind of going back to an earlier, point that you had, just the capitalist mindset. It's not that being a capitalist is inherently wrong. You yourself are doing that. Everybody should be looking out for, their own future and financial well-being, but at the same time, it does create a barrier when it's at that level throughout the country, right?
Well, what we want to do is actually create a little different operating system where capitalistic, endeavors still continue to compete, but they have to compete with, other forces that cause them to be more creative in how they provide services. So we're not interested in socialized medicine, and I don't think companies should be either. If we went to a socialized medical plan, like Medicare for All, that includes an 8.5% tax, per capita tax for every employee that you have. So if the costs go up next year because of some other problem, then you're not able to control your medical costs because they went up. But if we have a competitive system with the All Care plan that's based on aspects of Medicare as a basic plan, you can choose whatever plan you want as a company. You can be self-insured, you can use private insurance, you can use All Care, you can use All Care with insurance-based wraparound plans for more benefits around All Care. And insurance would not be a reason why you might stay with a company. You could move to another company if you know every company is going to have health insurance, because some companies have tremendous health insurance and others don't. So if we even the playing field, it actually would improve human resources as well. So it's a far-reaching plan. It takes a lot of time for people to understand it. And, it's challenging if you have to compete with a different market in your, well-established insurance business. And by doing what I said, we would affect them because 90% of their business is with employers, not with private individuals.
Right.
So while we believe it's a simple, straightforward plan, as we describe in our book, it will take some getting used to for the people who would have to compete in these markets. But they'd be able to do it. It would just be a different set of requirements for competition.
Right. Right. And Ed, I think this kind of ties in with a great piece of the show, and really, the Eric Mueller show, to look at successful individuals, what keeps them driven is kind of my main thread. And a thought that popped into my head here is when you created that idea and wrote that book. So that was a success in terms of you had the idea and it's flushed out, it's clearly defined. Another version of success would be if that was implemented in the U.S. or in other countries.
Sure.
But
Sure.
My question for you is how do you define success? Because you really could look at success in many different ways just on your book and idea alone. So, some people might look at it and say it's a huge success because you thought of that idea. And some others might say, well, it's not super successful unless it's implemented. So I'm curious, it's definitely up for debate, but I think it's a great point for an entrepreneur to know because, like you said earlier, you may think of things that fail or don't, not that your idea has failed by any means, but you might start a business if you're an entrepreneur and it doesn't take off like you thought it would, and you do lose money. So I guess, Ed, how do you define success in your life?
Well, I think at this point in my life, success is a stepwise thing. In other words, I wanted to study healthcare in a different way from my total work experience in terms of healthcare policy. I invested a lot of time to do that, and I was successful in that effort because I was able to write a book, and the book has gotten 5-star reviews. Mm-hmm. So that for me is a point of success. I am not, for me, getting the book out was successful, and it would be a great accomplishment if someone in government would embrace the idea that I've tried to share with them. And I realize that there are many different pressures on people in government. I was, part of my consulting practice, I was a strategic advisor on legislation for medical societies. And I would go to Washington and meet with the legislators. And I realized that they have all kinds of input all the time on the things that they're thinking about. So I just wanted to be a part of giving them something to think about, because the ultimate result on how healthcare changes in the United States is going to be what the Congress and the president do together in order to move it forward. And President Biden has improved the subsidies for Obamacare. More people have that coverage than ever before. And the government is embracing efforts to reduce pharmaceutical costs. And I would be very happy if they could do that. As I saw the pandemic coming, I thought, gee, what can we do to help doctors and nurses and healthcare people to be up to date on what's going on? This is changing very rapidly. And, being able to write a newsletter that goes out every 2 weeks with my colleagues, based on the research we continue to do, and having it out there and available, I believe is a successful thing because it's available and people can critique it, they can read it, they can do whatever they feel is important with that. And I feel the same way about, the book that we're going to be releasing in the next 2 weeks. It's there to help information. We have some interest in the library community from the book because they're saying this book is of historical interest. So if someone wants to look at the pandemic 10 years from now, they can read our book and say, oh, that's what they were dealing with in, that pandemic. So success can be an instantaneous thing. And if you interview someone in show business who's an instant success, you'll find out they've been working at it for 10 years.
Yeah. Yeah.
Or suddenly became successful. So to some extent, I believe success is a state of mind. Clearly you are successful if you can take pride in what you do, if you're honest about what you do, and you try to reach the goals that you've set for yourself. And sometimes you're not going to reach the goal. Does that mean you're not successful? Well, could be, or maybe you're still successful, because every situation is different and predictable, I believe.
Yeah, I think that's a great point, because you also don't want to let someone else determine your success, and you don't want to have a label put on you as you are or are not successful based on what someone else thinks. So, I mean, looking, from your story, looking at the fact that you created an idea that could save the country that much money and is that revolutionary, to me, I mean, that is hugely successful.
Sure.
Doesn't necessarily matter if it's implemented, but because there's so many other factors. I mean, you can't go break down the doors of those legislative people and just force them to implement. I mean, that's not what you're going to be able to do.
That would never work for sure. But it is what it is, and we keep on plugging away, and we enjoy what we're doing. We enjoy the conversations we have with people about this. I was speaking with someone about it. He said, $1 trillion a year. What if you're off? I said, okay, suppose I'm off 25%. We only save $750 billion a year. Is that a bad thing? And he laughed. I said, well, I get the idea now. Okay. It's a continuing dialogue, and we're happy to have the dialogue. My PR agent, whenever we do something like that, we send it out to 2,000 media outlets, and we get radio interviews and podcast interviews, and if you can talk to people about the ideas you have, maybe they'll resonate with some people, and that's what you want in a democracy. I mean, we're not dictatorial. It's it's a debate that should end up at the best place for everyone.
Right. And Ed, to further, dive into the success piece quick, and to be respectful of your time, we'll get you off here pretty soon. But so you define success as that stepwise approach where you're working at it day in and day out and slowly moving the needle towards your goal. And you shared that earlier with the time management piece. If you can just kind of figure out how to effectively move that direction every day, you're going to be chasing your success.
Yes.
But what keeps you?
It's just as a marathon, not a sprint.
Yes, exactly. And coming from a runner's background, that holds particularly true. But if you were to share what are a few driving forces that just keep your inner clock ticking towards that success on a daily basis, what gets you out of bed in the morning? What keeps you pursuing the success that you've had?
It's the evolving passion about ideas. For me, I mean, I believe I heard in one of your podcasts that a CEO said he woke up in the middle of the night and figured out how to name his company because he'd been thinking about it while he was resting. And I think that happens to everyone who is thinking about things they're passionate about, where they'd like to make a change that could, create the business for themselves or solve problems for others. So I think passion about the ideas that you have. As you learn something and your idea changes a little bit, if you have passion about that you really want to think about it and make it happen, that's really important. For me, that's the goal. Get up in the morning and start my day, think about what has to be done, address the issues, try to have some creative time. And if there are problems that have to be addressed, try to think about them as opportunities instead of problems so you can get through them and get done.
Exactly.
Those things always exist for all of us.
Yep, that's exactly right. Well, Ed, thank you so much for being a part of the show. Everybody that's listening, whether you're in healthcare or not, I think subscribing to the Healing American Healthcare Coalition would benefit you. The $1 a month, that's nothing. So definitely you can take advantage of having that newsletter sent to you every 2 weeks. And I'll tag the books for Ed as well. So if you're interested in reading those, the one that comes out in 2 weeks, when I update it, when it comes out, I'll include it on there so you'll still be able to access it. But Ed, if someone wants to reach out to you and learn more or connect with you personally, what would be your preferred method of contact? Are you on social media or email, or what would be best?
I'm on LinkedIn as Edward Eichhorn. You can get to me through the healingamericanhealthcare.org website at info at healingamericanhealthcare.org, or you can email me at ed@medilinkgroup.com, MEDILINK group.com, either by email or through the website or on LinkedIn. Any of those ways, I'm happy to reach out to anyone.
Perfect. Well, Ed Eichhorn, thank you so much for being on the Eric Mueller Show. We appreciate your insights. We'll wait for that day that the U.S. Government implements your plan, and we'll be able to cheers a success toast to you. So thanks for being on, and take care.
Thanks a lot, Eric. It was great to be with you. Good luck.
Appreciate it, sir. Thank you.